The next step in diagnosis is mammogram. Mammogram is an X-ray of the breasts, and we'll talk about the details in a bit, but it is the gold standard for breast cancer diagnosis. And the reason for this, it's the only proven method that will decrease the number of breast cancers. So that the reason we're having a decreased number since 1989 is really because of mammograms. So X-ray of the breast, it's a two view of the breast. On the left side of the screen, the A, we have the view of the head to the toes. So the CC top down version where we get the top part of the breast. And in the B picture, we have the medial lateral obliques where the machine tilts to its side, compresses the breast sideways. And this is just a very basic X-ray of the breast. And here, just to give you an idea of some things that we look at, this has what I like to call the positive arrow sign. So these arrows are directly pointing to things that we can find in the breast. A small circle, a larger mass where it's starting to pull in the breast tissue, and harder to see on the one on the right is some salt sprinkles or calcifications. But these are the types of things that we would see on a mammogram. Now, most mammograms machines are now 3D. Specifically, especially here at the Breast Center, we have 3D mammography, and it really is becoming the gold standard where we're getting multiple pictures of the breast. So not just two views, but multiple views in both directions. And it really is the best way to detect breast cancers, especially women with dense tissue, patients who have had surgery before, any scar tissues that show up. It's going to give us a much better picture of everything that's going on in the breast. It will also decrease the number of callbacks. So if they see something on your screening mammogram and they call you back for additional imaging, this will decrease the amount of times women get called back for that. So that callback being a diagnostic mammogram. Now these are different because the radiologist is looking at these images in real time. When the patients are presenting and there's an issue, there's a mass on the screening, or they come in with nipple discharge, we'll put in what's called a diagnostic. And because the radiologists look at it real time, they can do additional imaging, additional views, as well as an ultrasound. An ultrasound is really great to look at different things within the breast with a little bit more detail, but it's not as consistent as a mammogram, which is why we don't routinely use it for screening, but it is an important piece of workup. Now, anytime we see something on imaging, we can't for 100% surety know what it is without a biopsy. Now, a biopsy is where we take some tissue from whatever we're seeing in the breast, have the pathologist process it, look at it under the microscope. And this is done via ultrasound and stereotactic. So let's take a look at that. So here we have an ultrasound picture where the ultrasound probe is being held, and I wish I had a pointer, but we see the ultrasound beam going through the breast. We see that red dot being the mass and the needle coming through and taking a piece of it. That piece of tissue would then get sent down to the pathologist to have them look at it under the microscope. And here we have a very old picture of a stereotactic biopsy. This is where the breast is compressed via mammogram. And I say old because fortunately the machines are not lie down machines anymore. They're all upright machines, which is much kinder really to everybody. But that same idea where the breast will be compressed and the biopsy happens with a needle. I do just want to pause right here because I feel like we didn't get to talk about mammograms enough.
We didn't.
Let's talk about mammograms
yes.
a little bit, because I know the U.S. Preventative Task Force just came out with their whole guidelines. I have been fighting their guidelines since my fellowship. Not a joke, I wrote a paper on it. That being said, currently the task force just came out and said mammograms starting at 40 and every other year. Now, I'm sitting so I won't get on my soapbox, but here we go. The American Society of Breast Surgeons, so the body that governs what we do, and the American College of Radiologists, the one who reads the mammograms, they have always and forevermore recommended mammograms starting at 40 and yearly. And that is a hill I will die on. That will be forever what I recommend to my patients. I know that some providers are saying 45, I know some are saying 50, 40 and yearly. There's even some information saying women who have a family history of breast cancer need to get treatment or get screened earlier than 40. And at that point, if you do have a high family risk, of course, talk to your providers about what that would look like. But truly, it is so important to do it yearly. And to dovetail on that, self-exams. We know that women are diagnosed with breast cancer, 20% of breast cancers that are diagnosed are self-exams. So self-exams monthly, annual mammograms, and another 20% of breast cancers are diagnosed under the age of 50, but what the task force just came out and said is that it's actually higher than that now. Wow. So young women are getting diagnosed more and more often, and 100% yearly, 40 self-exams monthly.
So we're maybe like halfway through this, but I'm already taking, right, that I'm 40, right, and knowledge is power, and to do this yearly, to have that knowledge and that kind of peace of mind, right?
Absolutely.
Sounds like it could be really beneficial.
Absolutely. And for the mammograms, having your first mammogram is always nerve-wracking. I didn't like mine, that's for sure, because there's always that possibility of it's new and they have nothing to compare it to. So that possibility of getting a call back, having additional imaging can happen, as well as that transition from a 2D mammogram to a 3D mammogram. So women who have always had 2D mammograms who are now having a 3D mammogram and they get called back and they get nervous, now they're just seeing things in more detail. It might not necessarily be something. And about 80% of the time it's not. So really mammograms are hugely important.
We need that baseline, right?
Absolutely, absolutely.